Assalamu alaikum guys, how are you doing? Welcome back to my YouTube channel. In my last video we discussed about cataract, the definition, the types, and we also touched the management to some extent. But I said I will discuss this in my next video. So today we are going to discuss the management of cataract and the procedure that is commonly used, phacoemulsification. We are going to discuss this in detail step by step. Now, we need to know first how many types of surgeries there are for the removal of cataract, how many surgeries that used to be done but are now obsolete. So there's extracapsular cataract extraction, intracapsular cataract extraction, and pars plana lensectomy. Well, it's rarely used these days. Now, extracapsular cataract extraction, this is what we are going to discuss today because phacoemulsification comes in this type. In this, as the name suggests, extracapsular, that means the capsule stays but the lens is removed. Now the intracapsular means that the lens matter is removed with the capsule. This procedure was practiced until the 1970s and 80s, but when the phacoemulsification was introduced, this became obsolete. And pars plana lensectomy, well, pars plana is a part of the eye. It is a part of the eye in the middle layer of the eyeball, the uveal tract, near the uvea and the ciliary body. So through this technique the lens used to be extracted, but like I said, it is rarely used these days. So we are going to discuss about phacoemulsification, that is a part of extracapsular cataract extraction. There's another procedure that is in this category, and that is femtosecond laser cataract extraction, but we will discuss this again in some other video. Now let's come to the procedure phacoemulsification. Phacoemulsification is a widely used known procedure worldwide. It is safest of all procedure. Well, there can be other procedure, but this is one of the safest procedure. The average time of this procedure is 15 to 30 minutes or 20 to 30 minutes, depends on the surgeon. Now first you should dilate the eye. For that you can use various parasympatholytics such as atropine or sympathomimetics. So once the eye is dilated, you have to anesthetize the eye. Now for anesthesia, it's local anesthesia. That's the beauty of it. Now you can either use eye drops, patient can undergo this procedure with the use of eye drops, or you can go injectable anesthesia around the eye, which is known as peribulbar anesthesia. As the name suggests, peri, which means surrounding, bulbar, the eye globe. So surround the eye, either we can give it on the lower side or on the upper side. This anesthesia works fairly well for the amount of time that is required for this procedure. Now with this anesthesia, a person is usually scared. He says, maybe I can injure the eyeball. Well, in experienced hands, it is fairly less common. So once the anesthesia is given, you pat the eye and let the anesthesia takes its effect, usually for 5 to 10 minutes. Then you shift the patient to OT. Now once the patient lies, you first clean the eye with pyodine. Once it is cleaned with pyodine, you cover the face, the rest of the parts that need not to be operated, and just leave the eye open, and you place there 2 clamps that need to be there to keep the eye open. Now in this time the patient is awake but his eye is anesthetized, and you have to tell the patient to follow your commands. If you tell the patient to look down, he will look down or look up. So in this procedure you have to actually talk to the patient to listen to your orders and make sure he doesn't get up or do sudden quick movements. So the first thing in phacoemulsification, the first step is incision. Now this incision is a corneoscleral incision. Now this means that this incision is made at the junction at the cornea and sclera. A second incision is made at right angle to this incision, so the surgeon can introduce his instruments to help with the extraction of cataract. Now after this incision is made, the fluid in the anterior chamber comes out. Of course, the anterior chamber, posterior chamber, there is fluid, the intraocular fluid, which is usually raised in case of glaucoma. We all know that. So for that we introduce a viscoelastic gel. Now this gel keeps the anterior chamber of the eye in its place, and we can carry out our procedure. Once this is done, the next step is capsulorrhesis. Now in this procedure we remove the anterior capsule of the lens. This is done through an instrument, and the surgeon goes in a circular pattern to remove the lens capsule and makes an opening about 5 millimeters so he can carry out his procedure. The next step is hydrodissection. In this procedure, as the name suggests, hydro, which means water, is being introduced. Now this water is used to remove, or we can say to create a space between the lens cortex and the lens capsule, to loosen it up so it can be extracted easily. After this, hydrodelineation is done, which means hydro, again water, is being introduced, but at this time it is being introduced into the nucleus to remove, or you can say to separate the nucleus from the epinucleus, or in other words we can say to loosen it up so it can be extracted easily. Once this is done, nuclear rotation is done, again to loosen up the nucleus so it can be divided into further parts and then it can be extracted. After the nuclear rotation step, the surgeon makes a groove in the nucleus and then another groove at right angle to the first groove. Then the nucleus is divided into 4 parts and then further into smaller parts so they can be extracted easily. Otherwise we cannot extract the nucleus because sometimes it is so dense that you have to use high phaco power, but the high phaco power isn't that good for the eye because post-op it can cause some problems. Then the aspiration of residual cortex is done through the help of irrigation and aspiration cannula. Now this cannula that is used in OT procedures mostly is that in this cannula the irrigation and aspiration is done at the same time, so it is done irrigation aspiration cannula. You will see this once you go into OT, or you can see it in the image here. Then the capsular bag is inflated by viscoelastic gel again to keep the gel or to keep the capsule in its place. Then comes the part where the intraocular lens is introduced. Now this intraocular lens is foldable lens. It can be folded and kept in an instrument, and this instrument is introduced to the same incision where we introduced our previous instruments, and once it is introduced it is injected in the capsule bag that is already left in place. Remember, we do not remove the capsule bag because if the capsule bag is removed, the lens will float freely in the posterior segment of the eye. So for that the capsule bag is kept in place, but the lens matter, the cataract matter, is removed. Now it can be a foldable lens or sometimes a rigid lens is used. For a rigid lens the surgeon can increase the site of incision, the place where the incision was done, and he can easily introduce the lens. Once this is done, the beauty of this procedure is that you do not need to suture the corneoscleral junction where the incision was done because it is a self-sealing incision. After that you pad the eye with gauze piece and do bandaging, and the patient can go home on the very same day. That's the beauty of this, but he should be kept from half an hour to 1 hour in the daycare in case there are any post-op complications. But he can go home and he has to come back next day to check is the lens in the same place that the surgeon kept it or has it dislocated. So the next day checkup is a must for OT procedures. In fact, I should say for the intraocular lens or the cataract procedures. In the beginning of this video I discussed there are other procedures such as intracapsular procedures. In those procedures the lens matter along with the capsule is removed. So in that case you cannot introduce the lens at the same place because it will float freely in the posterior segment. So in those cases we place the lens in the anterior chamber of the eye just in front of the iris, and on slit lamp examination you will see something like this. But if it's placed in the capsule bag, then you will see something like this in phacoemulsification procedures. So guys, after watching this video I hope you must have gotten a brief idea about the cataract and its procedures. It is a worldwide use safe procedures. People are usually scared to undergo surgery because they think it can cause pain. Remember, the only pain in this procedure is that when the anesthesia is given, and that too injectable anesthesia. There will be no pain if anesthetic eye drops are given. So remember guys, next time you see an old patient with a cataract and he's afraid to undergo surgery, it is your duty to counsel him, take him to the right doctor and get him the best procedure that you can. Until my next video guys, take care.